Back now on Try today, we have a very lovely guest with us here to talk about something I think is a very exciting kind of topic that I hadn't heard about before, and she's going to clear it up for us. Jay Paul, Director, if we can meet Dr. Marissa Cangin. She is Director of Psychosocial Oncology Services at Emerywood Hematology Oncology. That's a Cornerstone healthcare practice. Welcome to the program.
Thank you very much.
Good to see you.
Happy to be here.
Now, I said a mouthful there, so I'm going to back up a minute, and I'm going to ask you what you mean when you say psychosocial care for cancer patients. What does that mean?
Okay. Well, psychosocial is shortened from biopsychosocial, but it is comprehensive services for anyone impacted by cancer, whether it be patients or loved ones, that takes into account physical, psychological, emotional, spiritual, and financial needs in order to obtain best outcomes.
So you're taking a look at the whole 9 yards.
We are,
How
whole person.
everything affects the residual things, the ancillary problems that crop up from cancer in the family, and you're there.
Exactly.
What kind of training is required to do what you're doing? I mean, it looks like you'd have to have your fingers in a lot of pot, learn a lot of things.
It's true. Well, it depends on the type of psychosocial services one wants to provide as far as the training. In my case, I earned my doctorate in clinical psychology, which included an internship and a postdoctoral fellowship, and then I actually sought specific training in psychosocial oncology. But any type of psychosocial support, it could be offered by so many people, from volunteers to somebody who wants to earn a degree in nutrition or social work or
But normally,
divinity.
if I were to go to a psychologist, and I should, but normally if I did, he or she would help me through whatever problem, but it wouldn't necessarily be looking at all of these ancillary issues like you're doing. So give me an example of some of the services that you would be able to provide through your practice.
Well, some of them are the traditional psychological counseling, like stress management to help with managing pain, reducing anxiety, improving sleep. But in addition to that, specifically in the cancer world, it includes coping with the emotional impact of receiving a life-threatening diagnosis. But it can also include concerns with spirituality. Some people feel very betrayed, not only by their body, but disrupted their relationship with their God, and then subsequently feel guilt. So managing
And then
those
there
emotions.
must be family things too, as we're talking
Yes.
about on this show with our good friends from hospice. And I can imagine a caregiver or somebody getting very upset and not sleeping and not taking care of herself or himself.
Right.
And there you reach out to them because you're doing the whole thing.
Yes, caregivers are at very high risk of distress and depression. And so for both patients and family members, untreated depression, we know, can interfere with outcomes because it interferes with treatment compliance, of course, quality of life, which is something that I say often.
Right.
So yes.
How do you coordinate what you're doing, though, with the medical doctor, the medical component, the doctor, he or she who comes in to treat this cancer medically? How do you make that work?
Well, there's nothing quite like face-to-face coordination. So now that I'm an integrated member on site, I can meet patients where they are. So that's in 2 different locations. And as well as our electronic medical record, we can efficiently communicate. But I can share an example that really touched me recently.
Yeah.
I was working with a woman on an outpatient basis, met weekly to address anxiety, coping with a breast cancer diagnosis. Of course, I won't share any identifying information for confidentiality. But she was reporting headaches. And now if I were an isolated, independent, separated psychologist, I might immediately refer her back to her doc and trust her to take care of that.
Right.
But knowing this patient's background and her culture, where she was actually working on not wanting to be perceived as a complainer, and also knowing a little bit about breast cancer, I asked a little more questions, not to treat it or practice outside of my scope,
Right.
But just to get a little more information and learn about the progression, and found out that it had been worsening, included vertigo, was debilitating.
You were able to treat it more effectively because
Yep.
you had all this other information at your fingertips.
Yep, and
because
I
of the comprehensive care.
Yes, and I contacted her oncologist with her permission, and within a week they found a brain metastasis and had it removed.
Bless your heart, and good for this lady too. I bet she wouldn't mind us having talked about that, even though you protected confidentiality. What a great inspirational story. Before we run out of time, I'm going to put something up on screen, www.cornerstonehealthcare.com. Lots of information there. Also, Emerywood Hematology Oncology, that's on Westwood Avenue in High Point, 802-2500, I believe is the number. You can correct me if I'm wrong. I think we have a few seconds left. Is this where we're headed in medicine and overall comprehensive treatment, do you think?
It is. We want to offer world-class treatment for patients We want to respect their mind, body, and their spirit. We want to normalize the discussion of emotions and coping, make it standard of care. So if you go see a psychologist, it's not because something's wrong with you, but because you deserve to have an extra person on your support team.
Good deal. Good deal. Marissa Cangin, thanks for all you do.
Thank you so much. It's an honor.
We'll be right back.